to the Bryan Hartson Show. We've got a great show for you today, and I am wearing my red shirt and my ho-ho-ho tie on today, and that's because today is the 30th of June, and tomorrow starts, guess what? Christmas in July. That's right, my favorite holiday. And today we have a great show with Leslie Parran. Now, Leslie has a lot of letters after her name and a wealth of practical experience under her belt. She is a functional medicine certified health coach and a registered nurse with a master's degree in oncology, with many years of nursing experience as well as certifications in nursing, oncology, gluten, emotional freedom technique, and essential oils. Leslie offers clients support to discover root causes of inflammation, pain, and disease, and that's important. Now, coming from a holistic nursing perspective of empathy, caring, and collaboration, Leslie's mission is to move clients from pain into peace. Her 40 years of nursing experience with cancer patients, personal experience with autoimmune disease, arthritis, pain, and family history inspires Leslie to help others overcome their health challenges so that they feel better, so that they move better, and live better as they age. Leslie consults with clients using functional lab testing to identify hidden causes of stress and provides personalized healing protocols to help them make their bodies work the way they're supposed to. Now, she coaches clients to develop their personal wellness vision and goals, providing empathetic coaching support, leveraging their values and character strengths to help them achieve their wellness goals. Come on, let's go meet Leslie. Let's go. Hi, and welcome to the Bryan Hartson Show. I am so glad to have you with me. Welcome to Christmas in July. As we get ready to close out the end of June today, I have got an amazing person with me, and Leslie is here with us to talk with us about some amazing stuff that's going on, where she's been, where she's come to, and what's up for tomorrow. Hi, Leslie. Thanks for joining us.
Hey, Bryan. I'm loving your Christmas in July theme because Christmas happens to be my favorite. So,
So, Leslie, tell us about what it is that you have done in the past that gets you to where you are today. But let's start from the beginning and work our way forward a little bit.
okay, that's going to take a long time, Bryan. You know, I'm kind of old.
Oh, okay.
Oh, yeah. Well, actually, you know, going back to my childhood, I actually had an experience where I had to have surgery in the hospital. And I had a nurse that took care of me, and I happened to have a lot of pain, and I felt at times I was ignored by some of the hospital personnel, and this particular nurse really listened to me and helped me manage my pain in the hospital. And that really motivated me ever since that time. When I was like 15, I thought, I want to be a nurse. And so I have had, of course, a long history of nursing. I have had over 40 years of nursing experience, and most of that was in really acute care in people with chronic disease, and including people with cancer and blood and marrow transplant, solid organ transplant, and even palliative care. So my nursing experience was always in that high-end care, and I cared for many patients with chronic pain, and actually helped to develop some algorithms to help people get off pain medication in the hospital that had become somewhat dependent on their pain medication to manage their pain. And so this was an area of interest to me, and something that I'm really interested in, really trying to figure out how to even help people get there in the first place now that I am no longer in the hospital setting. So.
Interesting. And so you're not in the hospital setting now. What is it that you did that made the transition? And you talked about algorithms. So can you talk a little bit more about that? Because that really caught my ear.
Okay, well, the algorithm actually was many years ago. I was a clinical nurse specialist in the area of oncology and blood and marrow transplant. And I felt it was very important, as you know, well, now, of course, it's highlighted, we have this huge opioid crisis. But back then, I recognized that patients who had been in the hospital and been relying on opioid medications to control their acute pain ended up becoming somewhat, their body became dependent on it. They weren't necessarily addicted, obviously, but their body became used to the medication, and we had to carefully wean them off. And nobody necessarily knew how to do it, and everybody was doing it different ways. And so one of my colleagues and I did a research study specifically with blood and marrow transplant patients, trying to figure out what is a safe way so that patients weren't experiencing untoward symptoms as we could wean them off that medication. And so pain has always been a big area. I think it's important to control pain, and I think it's most important to try to learn how to prevent pain in the first place. But when people have pain, I think we've learned many things over the years of what to and what not to do. And I, of course, am interested in helping people heal naturally at this point in my life. I sort of flip gears from working in a very acute and chronic, high-end disease in a university hospital, and am now trying in my own practice as a holistic nurse and health coach, really trying to help people look at the underlying causes of their pain and help them figure out those causes and address them.
Now, Leslie, how long have you been doing this on your own now? Because I've got a follow-up question I want to ask you.
Yeah, well, so I just transitioned really out of the hospital in the last year and a half, 2 years, and so this has been an interesting journey for me because I was interested in the arena of functional medicine and started to study it while I was in the hospital, still on the side, because it was interesting because I was having my own personal experiences, and I thought, this is an area when I retire from the hospital as a nurse that I really want to learn about. And then, of course, I myself started experiencing some issues with arthritis and autoimmune disease where I thought, this possibly could help not only me, maybe some of my family members, and then even how could I leverage this to help other people, even avoid getting chronic diseases or getting into the hospital, because as you are well aware, chronic diseases have skyrocketed and continue to skyrocket, and particularly in the United States, we see a lot of disease, chronic disease, because we're all eating the standard American diet. Most of us, I guess.
That's true.
So
that's true.
Yeah.
And so now, when you made that transition, was the transition before the COVID hit?
Yeah, it was sort of ironic. My company actually was laying off of many positions, and so I was in a higher level position, and because of that, I think I was one of them that was chosen to go on the path of finding my next journey. And so I thought, okay, and I was glad because I had already been planning to do this. I just hadn't pulled the trigger on getting the business actually started. And that was actually a challenge for me, as well as many of the colleagues I've met that are, from a healthcare background, but really don't necessarily have any clue how to start their own business. So
yeah,
it's been a high learning curve. Yeah, it's interesting. I really have learned a lot. Some of it I really like, and I think those things that maybe that I don't care for as well, or something that maybe ultimately I could choose to hire someone to help with.
So now that learning curve has to be even bigger for somebody that's going from hospital to basically private practice or private work, and then having COVID hit. You sort of, I think maybe you've got a blessing for that because you got it all rolled up into one, rather versus somebody else that has done their own private stuff and now they have to adapt again. So you've had to learn to adapt in an adaptive world. How are you dealing with patients? Because you obviously wouldn't be able to see them in person. So do you see, or I guess you would be clients of yours, do you see them by Zoom, by email? How's that working out?
Yeah, well, I think what's great about this arena is, the interesting thing, like you said, the timing of the hospital. All the hospital people were trying to reposition, and the, primary care practices and consultants, they hadn't really, telemedicine wasn't, as far along as it is, of course, right now, because people have had to scramble and learn. But in what I chosen to do in this healthcare coaching world is to really establish my own practice, which is online. And the interesting thing is, a functional diagnostic nutrition practitioner, I do have access to many, over 60 lab tests, many tests that can be employed, and basically my clients can do the testing in the comfort of their own home. In fact, if for some reason, and some of the tests require blood draw, you can actually have a lab come to you and draw. So this is, I think, very appealing to clients, because they can do this on their own, and then the coaching sessions, once the lab results are back, I have a results and review session with them to help them connect the dots on how they're feeling and how that correlates with what their test results are showing, and then try to develop a protocol for them and we have coaching sessions on Zoom to really help them. And so I have access to a medical record and everything, where they can see their own test results, and I can communicate with them as needed between sessions.
And now, getting tested at home, getting the blood draws at home, it's relatively safe. It's as if you were applying for life insurance, right? I mean, they come out and everything's sterile, and they give you a little stick. A couple days later, you get the email of, hey, we need to have a serious conversation.
Right. Well, yeah. I would never do life insurance, so I got to tell you. But anyhow, I'm trying to save lives here. But just a little joke. But yeah, and people can go to their own lab. Many of people have clinics or labs, and in fact, many of the labs that I access their testing, they actually have on their sites where the clients can go to get tested in their area. So it's not really that hard. You can go to a place to get your blood draw if you need a test drawn with blood. But many of the tests actually are either saliva or stool, or even now we're seeing a lot more blood spot testing. So you can actually, in your own home, kind of like do a finger stick prick and put your little drop of blood on a little lab card and send it in. And so a lot of these processes are getting a lot easier. Many are developing a lot higher reliability. And of course, the testing that I do, now I also have access to testing, like normal testing, like you would get a CBC or blood chemistries drawn at your doctor's office. But what functional practitioners do that's different is functional medicine tests that are really designed to help understand how a person's body is functioning, and where that body may show hidden clues to what's going on to create whatever symptoms or issues they're having, whether it's pain or fatigue or inflammation, et cetera. So I think functional medicine is really a wonderful field, and I'm very convinced that by understanding the roots of our disease and what is causing us to develop symptoms, we can really then reverse potentially conditions or prevent disease from happening. And if you can, whether it's if you have food sensitivities or exposure to toxins, or you have pathogens in your gut that you're not aware of, a lot of these things can be uncovered by functional medicine testing.
So, and that really leads me into my question about what functional medicine is, because I think that's a word that can sound pretty scary, especially when you're talking about going from a traditional doctor. A doctor's just going to go run some blood tests. You're talking about specifics with a function that's tied to a test that's tied to a specific function. Would that be an accurate statement of it?
Right, exactly. And in terms of as a health coach, and as a functional diagnostic practitioner, health coach, while we are not like the functional medicine people, the doctors in functional medicine, we still have access to testing. And what we're doing is we're not necessarily diagnosing as a health coach, but we can actually uncover hidden imbalances, whether they be hormones, immune system issues, digestion, detoxification, energy imbalances, or even nervous system issues. And so this testing is really looking for some roots, what's going on in the roots that is causing, what the branches are. If you look at it as a tree, if a tree is sick on the top, the leaves are falling off or the bark is peeling or what have you, there's usually something to happen with the way the tree is being fed with water and minerals and those kind of things. And the same is true of a person. If you're not eating the right diet for your body type, if you are not getting the right amount of nutrients, if you don't have good mitochondrial function where you're getting enough energy, you're going to experience imbalances. And in the FDN world, functional diagnostic nutrition world, we call that metabolic chaos, where we see imbalances in all those body systems that we look to rebalance the body, because the body always wants to rebalance itself until it can't. And so then once we find out what is happening and with the test results, we can, with a generalized protocol, help people with diet, rest, exercise, stress management, and supplementation where we see it's needed for that individual. And we can sort of personalize a protocol to a client to help them get beyond what the test results are showing.
Gotcha. On the other side of the break here, I want to dig into that just a little bit more, okay? Stay with me. We'll be right back.
Hi, this is Philip with Trinity Teas, and we're at the Old Town Temecula Farmers Market in Temecula, California, Saturdays 8 to 12:30 p.m. And we're talking about our teas, and the Golden Milk is all anti-inflammatory. It's ginger, turmeric, and cinnamon, sampled in a vanilla almond milk, extremely anti-inflammatory. We sample it in the vanilla almond milk, no dairy, no caffeine, and we make it taste like a Mexican drink called horchata. If you haven't tried that before, it reminds people of like a cinnamon toast cereal or a nice dessert drink. So come and check us out at the Farmers Market in Old Town Temecula, Saturdays 8 to 12:30. Have a good day.
All right, and we are back here with Bryan Hartson on the Bryan Hartson Show. And we actually have got an amazing conversation going on with Leslie. We're talking about functional medicine right now, and I'm going to pop up here real quick. This is a QR code. If you have your phone, just go ahead, bring it out to the picture, and you should be able to just click on that little square box right there. It's going to take you over to Leslie's Facebook page, where you can get a wealth of information about Leslie and what she's doing. Or if you're old school and you don't have your phone handy, or you don't have one of those smartphones, there's the website address right there at www.facebook.com, Piece by Piece Wellness Coaching off of Facebook. And let's get back into talking with Leslie about really the amazing things that she's developed as she's decided to go on her own and explore a whole new world, as Disney would say. So
I'm not going to sing.
Okay. Well, okay, Alice. So, Leslie, I do want to know more about functional medicine, and you were talking about was it TDS or something of that sort? Tapping.
EFT.
EFT. Okay.
EFT. Yeah.
I was really intrigued to touch on that, and I'm hoping that you can explain that a little better to me, because I'm just not smart in that aspect of stuff, but it really seemed like it was something neat.
Yeah, I think there's many approaches to pain, and many natural approaches, and not any one thing works for any one person. Like some people, even meditation can be very helpful, and some people just really feel meditation doesn't work, or deep breathing is one thing that you can do if you have anxiety or even pain, right, to reduce pain. But EFT, or emotional freedom technique, is really a technique designed to help people cope with whether anxiety, pain, or if they're dealing with even sometimes traumatic experiences, sort of break the cycle in their brain. And it's sort of along the similar concept of acupressure or acupuncture, and you're tapping specific points. And if people are know Ayurvedic medicine and chakras and those kind of things, and it's really sort of a similar thing, but just a technique to sort of disconnect the person from that issue that they're having, and trying to retrain their brain so that they can, in my case, I'm working with people that are predominantly having pain.
Okay, so the tapping, just so I'm getting this straight, is literally tapping on the head. It's basically resetting the brain a bit.
It's not just the head. You're tapping on your head, you're tapping here, you're tapping on your here, and you're tapping here, and you're saying certain things while you're doing it, either to yourself, or in some cases people prefer to do it out loud. But you're also tapping on different points on your hand, and underneath your arm, and on your chest. So it's really, it's a process that's been sort of simplified over the years. And there's even apps out there to help people learn how to do tapping, so that it can really help them deal with issues such as anxiety or pain. So it's just one method.
And anxiety right now is pretty high with COVID. I assume you're seeing, I'm making an assumption, but I'm assuming you're seeing a lot of people going, hey, I can't, I'm still not ready for what's next, what is next, right?
Yeah, I mean, for first of all, stress, and even before COVID, is the number one thing that is really causing inflammation. And if you looked at inflammation, the number one triggers are food, pathogens, and toxins, right? But stress is a lot of times at the root of what triggers inflammation and causes multiple issues for clients. And so it's true that in the time of COVID, a lot of people are struggling to cope with all of the changes, the fear of being exposed to the coronavirus, et cetera. And so anxiety certainly has increased, and it's sad because a lot of children, of course, are impacted and even afraid to go back into their schools and that kind of thing for those kids who have had the misfortune of not being able to go back to school.
And that's interesting. What's happening right now is probably we're not going to see the results of the effect of the negative effect of the kids and stuff until a year or two, maybe even farther down the road, I would assume. Would that be a fair assumption?
I think so. I mean, it's going to be very interesting to see the long-term impact, and I'll be very interested in seeing the studies. And I think social interaction is so important for children, and of course, as we know, even for adults, what ends up killing the elderly a lot of times is that social isolation. That when they're socially isolated is really when we start to see people decline. And so being social and being able to have family and friends is really important in developmentally for children, as well as for adults.
Excellent. Good information. I do want to ask you a question. I'm going to change topics a little bit and talk about allergies, intolerances, and sensitivities with regard to food, because I know that's a key thing as well in keeping our bodies healthy. Can you tell us a little bit about the difference between those three?
Well, I think, really people get them very confused. In fact, when we think of allergies, most people think of going to an allergist, right? And they're pretty much testing for what's called an IgE allergy or a true allergy. And IgE is basically the antibody that is caused when someone is exposed to. So typically you might think of somebody with a peanut allergy, right? That's a true IgE allergy. Yeah, or sometimes eggs. Although eggs, for example, could be a food intolerance. A lot of what a food intolerance is really the body mechanically and functionally just doesn't like digesting whatever it is. And some cases it's eggs or lactose. When you think of somebody that's lactose intolerance, that's having a relatively food intolerance. But what I think a lot of people get confused about is food sensitivity. So For example, I test myself for food sensitivities, and I had like 20 food sensitivities. And the test I used was a test that tested for, actually tested my blood and saw if I released certain inflammatory signals, like called cytokines and other different types of, I won't get into the technical part of it, but it could basically say if they exposed my blood to that substance, did it react and cause inflammation, release those inflammatory cells. And so food sensitivities, you can have a food sensitivity without having a gut issue. So just people often think, well, I would have diarrhea or bloating or gas or something or other. If I had a food sensitivity, I would know. And that's not necessarily true. Food sensitivities can show up as migraines, joint pain, a myriad of different things. Or even you can, if, for example, for those folks that are gluten sensitive, they may develop autoimmune diseases, whether it's Hashimoto's or lupus, those kind of things. And so it's really important part of the work that we do as functional diagnostic nutrition practitioners is really trying to understand the right diet for your type. And that's one of the first things I do is really looking, is the person eating the right diet for their type? And if they have any food sensitivities, what I'm going to want them to do is going on a 90-day protocol to eliminate all those foods. And some of them, they might be able to add back very slowly to see if they have any reactions. But food sensitivities take up to, 72 hours to possibly show up. And so I could eat something now, and 3 days later, I might get a migraine and not know that it was related to the fact that I ate walnuts or something like that, right? And so that's the hard thing, is the connecting the dots between a food causing a problem for you. And so that's where testing can, in some cases, be very helpful. Some of the types of food sensitivity testing out there, however, are not extremely reliable. You can get false negatives or false positives. The MRT LEAP 170 test that I like to use, that is a mediator release test, and it tends to show, it's had studies to show a high correlation with people who are reactive versus non-reactive to food. So they could actually tell that that is picking up and detecting food sensitivity. So yeah, food sensitivity is a really interesting thing. And if anyone is identified as having a gluten sensitivity, unfortunately, for those out there that do have that, that would never be recommended to be added back. And so we would ask somebody to go on a gluten-free diet. But other foods could be.
Right, I'm hearing that a lot of people that are gluten.
Yes.
Allergic or whatever you want to call it there.
Yeah.
And even the restaurants now, they have everything there says gluten-free. Pizza.
Yeah, and it's true. And that's the good news. There's more, for whether a person has a particular diet preference. Certainly, we've seen a lot more options out there over the years, and that's a great thing. I still think the restaurant industry, you have to be very careful if you have a food allergy or sensitivity, because not everyone is well trained on these things. And of course, most restaurants will say they can't guarantee that everything is gluten-free, and even the food products in the shelf in the market will, and if they say gluten-free, they're definitely gluten-free, but they might be produced right in a factory where there's a wheat-related product or something in there. So,
or touching cross-contamination, right?
Exactly. Yeah, and who would have thunk? There, I guess it's some restaurants, they make sticky rice and they put a little flour in there, and you'd think, okay, I can have rice, but you might need to ask the server to ask the chef, do you throw in a little flour in your rice? So you got to be careful.
Crazy. Yeah.
Mm-hmm.
Hey, Leslie, we're just about out of time, but I'd like you to give some words of encouragement to the audience as we close out today.
Yeah, well, I truly believe, Bryan, that people don't need to live with their symptoms. People can work to find out and uncover what are the hidden causes of their symptoms and take opportunity to control their own health. And while it takes time and patience, it's not a quick fix like taking a pill for every ill. I truly believe they can find the root causes of their health issues and in many cases turn them around.
Awesome. Leslie, I want to thank you so much for being a part of the show today. And I also want to make sure that everybody has the ability to go right there to the bottom of the screen, where there I am, bottom of the screen, to pick you up at Facebook. Really enjoyed the time with you. Thank you for being part of my kickoff show for Christmas in July. And
I love it.
We will be back tomorrow with another great show. Hopefully you'll be able to join us. In the meantime, remember, this is the first day of the rest of your life. Make this second count.